Hi, I'm Eric Lichtenstein, and I'm a pediatric ophthalmologist.
When we talk about myopia, what we mean is that the image that comes into the eye doesn't quite reach the back of the eye, the retina, right? The image has to be in focus in the retina in order for the retina to convert that into a message that the brain understands. And if the image coming in doesn't quite get back there, it's out of focus. That's myopia. And people with myopia are able to see things up close, clearly, but at distance, it's not clear. The problem with myopia, though, is some kids, the eye just keeps growing. And it's not supposed to keep growing that much. And they end up with a high degree of myopia. As that eye grows, it puts mechanical stress on the inside of the eye. And if the retina gets stretched when you're older, that can lead to a number of very significant eye diseases, some of which can lead to vision loss. There's been a lot of research. And some of the most promising research has actually come out of the pediatric ophthalmology groups. They started experimenting with different doses of a medication called atropine. The atropine eye drops that are used on the eye are at an extremely low concentration. If we use these very low doses of atropine during the time that the eye is growing, during childhood, we can slow down the growth of the eye. It's not 100% that the eye would stop growing and be abnormally long, but we can have a marked impact on it. About 90% of children will respond to this very low dose atropine, and we can reduce the growth of the eye by about 50% from what it would have been. The right time to initiate myopia management is when we find that myopia is present at an earlier age than would be predicted, or we find that the eye is growing faster than would be predicted. We have good growth curves that help us with this, and we have specialized equipment in the office that lets us measure the size of the eye. I don't even need the kid to be verbal. I could do this on a newborn. That's one of the things that we're particularly skilled at here. We can determine if the child has myopia and whether the myopia exceeds age norms. We believe that by managing the myopia and reducing the overall length of the globe, we're saving them from a lot of potential problems down the road.